Okay, interruptions of weight loss. I'm going to start this again. From Pounds and Inches by Dr. Simeons. We distinguish 4 types of interruption in the regular daily loss. The first is the one that has already been mentioned, in which the weight stays stationary for a day or two, and this occurs particularly towards the end of a course in almost every case. The plateau. The second type of interruption we call a plateau. A plateau lasts 4 to 6 days and frequently occurs during the second half of a full course, particularly in patients that have been doing well and whose overall average of nearly a pound per effective injection has been maintained. Those who are losing more than the average all have a plateau sooner or later. A plateau always corrects itself, but many patients who have become accustomed to a regular daily loss get unnecessarily worried. No amount of explanation convinces them that a plateau does not mean that they are no longer responding normally to treatment. In such cases, we consider it permissible for purely psychological reasons to break up the plateau. This can be done in 2 ways. One is a so-called apple day. An apple day begins at lunch and continues until just before lunch of the following day. The patients are given 6 large apples and are told to eat 1 whenever they feel the desire. Those 6 apples is the maximum allowed. During an apple day, no other food or liquids except plain water are allowed, and of water they may only drink just enough to quench an uncomfortable thirst if eating an apple still leaves them thirsty. Most patients feel no need for water and are quite happy with their 6 apples. Needless to say, an apple day may never be given on the day on which there is no injection. The apple day produces a gratifying loss of weight on the following day, chiefly due to the elimination of water. This water is not regained when the patients resume their normal 500-calorie diet at lunch, and on the following days they continue to lose weight satisfactorily. The other way to break up a plateau is by giving a non-mercurial diuretic for 1 day. This is simpler for the patient, but we prefer the apple day, as we sometimes find that though the diuretic is very effective on the following day, it may take 2 to 3 days before the normal daily reduction is resumed, throwing the patient into a new fit of despair. It is useless to give either an apple day or a diuretic unless the weight has been stationary for at least 4 days without any dietary error having been committed. Okay, reaching a formal level. The third type of interruption in the regular loss of weight may last much longer, 10 days to 2 weeks. Fortunately, it is rare and only occurs in very advanced cases, and then hardly ever during the first course of treatment. It is seen only in those patients who, during some period of their lives, have maintained a certain fixed degree of obesity for 10 years or more, and have then at some time rapidly increased beyond that weight. When then in the course of treatment the former level is reached, it may take 2 weeks of no loss in spite of HCG and diet before further reduction is normally resumed. Ooh. Menstrual interruption. The fourth type of interruption is the one which often occurs a few days before and during the menstrual period, and in some women at the time of ovulation. It must also be mentioned that when a woman becomes pregnant during treatment, and this is by no means uncommon, just like Bobby Joe's daughter, she at once ceases to lose weight. An unexplained arrest of reduction has on several occasions raised our suspicion before the first period was missed. If in such cases menstruation is delayed, we stop injecting and do a precipitation test 5 days later. No pregnancy test should be carried out earlier than 5 days after the last injection, as otherwise the HCG may give a false positive result. I don't have to worry about that. Dietary errors. Any interruption of the normal loss of weight which does not fit perfectly into one of those categories is always due to some possibly very minor dietary error. Excuse me. Similarly, any gain of more than 100 grams is invariably the result of some transgression or mistake, unless it happens on or about the day of ovulation or during the 3 days preceding the onset of menstruation, in which case it is ignored. In all other cases, the reason for the gain must be established at once. The patient who frankly admits that he has stepped out of his regimen when told that something has gone wrong is no problem. He is always surprised at being found out, because unless he has seen this himself, he will not believe that a salted almond, a couple of potato chips, a glass of tomato juice, or an extra orange will bring about a definite increase in his weight on the following day. Very often he wants to know why extra food weighing 1 ounce should increase his weight by 6 ounces. We explain this in the following way. Under the influence of HCG, the blood is saturated with food, and the blood volume has adapted itself so that it can only just accommodate the 500 calories which come in from the intestinal tract in the course of the day. Any additional income, however little this may be, cannot be accommodated, and the blood is therefore forced to increase its volume sufficiently to hold the extra food, which it can only do in a very diluted form. Thus, it is not the weight of what is eaten that plays the determining role, but rather the amount of water which the body must retain to accommodate this food. This can be illustrated by mentioning the case of salt. In order to hold 1 teaspoonful of salt, the body requires 1 liter of water, as it cannot accommodate salt in any higher concentration. Thus, if a person eats 1 teaspoonful of salt, his weight will go up by more than 2 pounds as soon as the salt is absorbed from his intestine. To this explanation, many patients reply, well, if I put on that much every time I eat a little extra, how can I hold my weight after the treatment? It must therefore be made clear that this only happens as long as they are under HCG. When treatment is over, the blood is no longer saturated and can easily accommodate extra food without having to increase its volume. Here again, the professional reader will be aware that this interpretation is a simplification of an extremely intricate physiological process which actually accounts for the phenomenon. So just believe him. We aren't doctors. Salt and reducing. While we are on the subject of salt, I can take this opportunity to explain that we make no restriction in the use of salt and insist that the patients drink large quantities of water throughout the treatment. We are out to reduce abnormal fat and are not in the least interested in such illusory weight losses as can be achieved by depriving the body of salt and by desiccating it. Though we allow the free use of salt, the daily amount taken should be roughly the same, as a sudden increase will of course be followed by a corresponding increase in weight as shown by the scale. An increase in the intake of salt is one of the most common causes for an increase in weight from one day to the next. Such an increase can be ignored provided it is accounted for. It in no way influences the regular loss of fat. Water. Patients are usually hard to convince that the amount of water they retain has nothing to do with the amount of water they drink. When the body is forced to retain water, it will do this at all costs. If the fluid intake is insufficient to provide all the water required, the body withholds water from the kidneys and the urine becomes scanty and highly concentrated, imposing certain strain on the kidneys. If that is insufficient, excessive water will be withdrawn from the intestinal tract, with the result that the feces become hard and dry. On the other hand, if a patient drinks more than his body requires, the surplus is promptly and easily eliminated. Trying to prevent the body from retaining water by drinking less is therefore not only futile, but even harmful. You will be assimilated. Star Trek, I think. Something is futile. Okay. Constipation. An excess of water keeps the feces soft, and that is very important in the obese, who commonly suffer from constipation and a spastic colon. While a patient is under treatment, we never permit the use of any kind of laxative taken by mouth. We explain that owing to the restricted diet, it is perfectly satisfactory and normal to have an evacuation of the bowel only once every 3 to 4 days, and that provided plenty of fluids are taken, this never leads to any disturbance. Only in those patients who begin to fret about 4 days do we allow the use of a suppository. Patients who observe this rule find that after treatment they have a perfectly normal bowel action, and this delights many of them almost as much as their loss of weight. Okay, I'm going to stop there. The next chapter will be investigating dietary errors. See ya.